this country, see, I've chanced on a data comparing the health of people living in illegal mining areas and non-illegal mining regions. And the result will shock you. Stay with me and let's find out. The data used in this research is based on reports from the Ministry of Health, Ghana Health Service, Environmental Protection Agency, and some NGOs. And this covered a period from 2021 to 2024. That's a 4-year period. So this is a comprehensive study. But it focused on regions where illegal mining has impacted the most in terms of health. And these were the Western region, Eastern, and Ashanti regions. So they were some of the finest regions in Ghana. The research interestingly focused on 3 main areas. Issues related to respiratory diseases as a result of air pollution from illegal mining activities, as we call galamsey. Waterborne diseases such as cholera and heavy metal poisoning from polluted water bodies. Look at this. According to health reports, mercury contamination and cyanide exposure have become common in these regions, and this is leading to chronic ailments, particularly affecting vulnerable groups like children and even the elderly. Let's take respiratory disease for instance. If you look on your screen, you can see a rising trend from 2021 to 2024. Evidently, in 2021, cases recorded were 430 but increased astronomically to 560 in just 4 years. But if you look at cases in non-affected regions, and you are looking at regions like the Volta and northern regions, the cases of respiratory diseases such as asthma and bronchitis are relatively stable from 210 to just 215. So evidently you can tell that in galamsey mining activities like the Western, Eastern and Ashanti, they are recording more respiratory disease cases. And so there are more cases of asthma, more cases of chronic bronchitis for instance, as compared to areas where galamsey activities are not going on. But what does this trend tell us? Over here, the reports state that we can attribute the increase to pollution from mining activities clearly, and this includes release of toxic substances, mainly mercury and lead. Some also attribute it to cyanide and other particulate matter into the atmosphere. Let's look at waterborne diseases, which is the second health issue that the research was carried on. You realize that it is not entirely different from the respiratory diseases. You can see a disparity between the affected regions and then the non-affected regions where illegal activities are not happening. In 2021, for instance, 980 cases of waterborne diseases were recorded in these 3 regions, as I mentioned earlier, Eastern, Western, and then Ashanti. It increased to 1,180 as compared to just 510. That's about 50% in non-affected areas. And what are some of these common waterborne diseases recorded in illegal mining areas? Cholera, diarrhea, dysentery. If you are in the northern or even Accra, when last did you hear of cholera? But if you go to these illegal mining sites, cholera is still an issue, dysentery is still an issue. This shows the devastating effect of polluting these water bodies in the illegal mining areas. But how does this pollution occur? Usually they use chemicals such as the mercury and the cyanide, as I told you. And so once these chemicals are used to contaminate the water, the people within these communities use this same water for daily use. Some use it for farming, some even drink from it, and some use that same water to cook.
Water has been polluted. Cleaning up this water for human consumption is becoming more and more expensive. The problem we have in Ghana is that illegal mining has only exacerbated the situation if we find ourselves. Unfortunately, this water that have been polluted by illegal miners find its way into our water streams and the source of water for drinking, and even end up in the ocean as well. And cumulatively, this affects the health and well-being of our population.
This is not good. Let's look at the third and final issue, heavy metal poisoning cases. You can see that non-affected areas are recording an average of 30 cases per every 100,000 compared to places where galamsey is rampant, and these are recording around 270 just this year from 184 years ago. This shows the devastating effect of galamsey. Another interesting finding from this research was the cost of healthcare in galamsey areas. You realize that galamsey is not just affecting the health of people, but also increasing the public pest. And so you realize that in these areas, the government is spending more in treating people experiencing respiratory and these waterborne diseases. Look at this. The Ghana Health Service says that the average cost of treating a respiratory disease case in public hospitals is about 300 Ghana cedis annually. But in galamsey-affected regions, where respiratory diseases are surged to 560 cases per every 100,000, as I showed you, the cost has increased to 168,000 per every 100,000 people annually. If you look at waterborne diseases, the government is spending about 295,000 Ghana cedis. And then for heavy metals, we are spending close to 405,000 Ghana cedis. But the cases are less than 50% in non-galamsey areas. To sum it up, the health data from Ministry of Health, Ghana Health Service, Environmental Protection Agency, which was put together by Modern Ghana, shows that in galamsey growing areas like the Western, Eastern and Ashanti region, they are recording more cases of respiratory diseases, waterborne diseases and heavy metal pollution. And so in these areas, we are recording more issues of cholera, dysentery, bronchitis and other respiratory issues. And this calls for urgent attention from governments, NGOs, and civil society. Alright guys, I want to hear your take on the galamsey issue in Ghana, so drop your comments, also share with your friends, and if it's your first time on Wellness HQ, do well to hit the subscribe button and stay tuned for more health related issues. Alright, stay safe.